I'm Professor Boel Rasmussen, and I'm the Chair in Nursing in the QPS Western Health Partnership. In this role, I lead the Nursing and Midwifery Research Centre, which aims to conduct collaborative clinical research and provide staff and students the opportunity to engage in clinical-focused, multidisciplinary research across acute, chronic, rehabilitation and community healthcare setting. My research program have two arms. One arm focuses on empowering people with chronic and complex conditions to self-manage their condition by using technologies. The second program focuses on the implementation of research evidence into practice, using different approaches to increase the uptake of research by clinicians to improve patients' outcome. Another key activity in the centre is to build research capacity among nurses and midwives by supporting research projects and supervision of Bachelor of Nursing Honours, Master of Nursing Praxis and PhD students. The centre therefore provides academic and professional leadership to staff and students and recognises the importance of combining expertise from industry, community and academia to inform quality, best and right, safe healthcare delivery. Additionally, the Centre fosters interdisciplinary and international research collaboration. We are currently engaged in numerous multidisciplinary and international research projects, and we receive international visitors and scholars that collaborate with clinicians at Western Health to establish common ground for research that improve patients' experience and delivering evidence-based care.
I'm Dr. Karen Winter. I'm one of the research fellows on the School of Nursing and Midwifery QPS Western Health Partnership. At Western Health, we conduct two kinds of research projects. The first one is the projects that involve the whole of the organisation, and the second one is more localised projects that are specific to a kind of area or a kind of ward, or perhaps women's and children's services that are usually driven by the nurses and midwives. One example of a project that involves the whole of the organisation has to do with the implementation of electronic medical records, or EMR. We are doing a pre- and post-implementation study where we are investigating nurses and midwives' perceptions, attitudes, acceptability and use of EMR, and this will inform change management and support the nurses and midwives as they transition to using EMR. It will also identify some barriers that the organisation might need to address in order to make the outcomes of the implementation more positive.
So, for the future, for the research centre at Western Health, we're hoping to increase the engagement with nurses and midwives at Western Health, and also to engage with the community group in which we serve. And the population we serve at Western Health is particularly diverse and belongs to the vulnerable groups. So we hope that we can engage with those community in terms of improving their general health.